I've been concerned for a very long time about what we're calling, and truthfully so, the war on women. We saw so many bills coming through this General Assembly during the last session, and there have been many others that have been filed since then that continue to attack the integrity of women and interferes with her right to a healthy procedure and to have a contact, the kind of contact that's appropriate with her physician. I was very displeased this morning to sit in the J Committee to hear House Bill 716, as many of the presenters talked a lot about wanting to protect women. And there are many, many ways that we can do that, and of course there have been many bills that have been filed to protect women and not discriminate against them. For example, we've not done anything about pay equity, about workers' rights, and all those ways in which we could have made efforts to improve the lives of women. So as far as I'm concerned, a lot of these bills are simply smokescreens, and House Bill 716 is another one of those. There are countless ways in which we as legislators can work to improve the lives of girls and women without interfering in a woman's deeply personal decision to choose adoption, to raise a child, and even to end a pregnancy. Legislation already introduced in the General Assembly shows how some elected officials, some politicians here care about women. House Bill 716, not a single sponsor of that bill, for example, signed on to the recently introduced Equal Pay Act, House Bill 603, would have ensured that employees in North Carolina pay the same wages in the same establishment for the quality and the quantity of work for women. Every sponsor of House Bill 730, which would have allowed, not a single sponsor, of House Bill 730, for example, would have allowed an employer in North Carolina who opposes birth control for personal religious reasons to carve out contraceptive coverage from the employee health plan. Also, the sponsors of 716 did not support this. Every single sponsor of House Bill 716 voted to block Medicaid expansion. That was one of the first bills that passed this General Assembly that would have provided coverage for thousands of women and their families in North Carolina. And more, when we look at the numbers, we see that more than 20% of the women in our state between the ages of 18 and 64 are still uninsured. Then finally, I want to say about that bill that I was very concerned about what data existed that would support such a bill coming forth in this General Assembly. And the evidence that we were given was that this is happening in other parts of the world where women who are having abortions they are choosing to do so because of the sex of the child. In other parts of the world, not in North Carolina, not in even our neighboring states in Virginia and South Carolina. So as far as I'm concerned, this bill is not really what it purports to be. Like a lot of other legislation that has come through this General Assembly that's waiting to be heard, some have already passed, continue to discriminate against women and continue to make it difficult for women to make decisions about the circumstances of her health with her doctor. So I think this is another very disgusting piece of legislation that again has an opportunity to do an awful lot of bad things by not allowing people to make those decisions, women in particular, about their health with their doctors. The other thing I want to say is that I believe that this bill and many others that we've seen are simply a way of creeping up inch by inch to ultimately ban legal medical procedures in our state. And I would hope that this General Assembly, if they really want to talk about protecting women and also protecting them in a way that they would not be discriminated against, that we would not continue to see these kinds of bills come forward which actually do that very thing.